Hi, my name is Yamilet and I will be doing my skills video on the subcutaneous injection. I have gathered my supplies here, which is my patient, my gauze, my syringe with my needle, my medication, gloves, and alcohol pads, and a sharps container. The first thing we're going to do is verify the healthcare provider's orders, which reads heparin 1000 units subcutaneously, 1 dose. Next, we're going to do the 6 patient rights of medication administration, which is the right patient, the right medication, the right dose, the right time, the right route, and the right documentation. Once we have done all our checks, we can go ahead and calculate how much medication we will be administering to the patient. So we do have to do some math. The provider orders read heparin 1000 units subcutaneously, and the medication vial reads 10,000 units in 10 milliliters. After doing our calculations, we will give the patient 1 milliliter of medication. Once we have done that, we are ready to approach the patient. We're going to close the door behind us for privacy and introduce ourselves to the patient. Hi, Mr. Smith. My name is Yamilet, and I will be your nurse for today. Can I have you state your full name and your date of birth? We're going to check that against the wristband to make sure we have the correct patient. And now we're going to check if the patient has any allergies to medication, food, or environmental allergies. Mr. Smith, do you have any allergies to medication, food, or environmental allergies? No? Okay. Now we're just going to explain to the patient what medication we will be administering, what is it used for, what dose we will be giving to the patient, common side effects, adverse effects, and answer any questions if they have any. Okay, Mr. Smith, so your healthcare provider has ordered heparin, 1 milliliter. Heparin is an anticoagulant, which is also known as a blood thinner, that helps prevent blood clots from forming or getting larger. Some side effects will be mild pain, bruising, or redness. Some adverse effects are blood in the urine, nosebleeds, or difficulty breathing. I do want to let you know that just with any injection, you will have some burning or stinging sensation at the injection site when I give the injection, but that should resolve pretty quickly. Do you have any questions before we get started? No? Okay. We're going to perform hand hygiene. I'm going to go ahead and put on a clean pair of gloves on. Okay. So then now that we have our gloves on, we're going to grab one of the alcohol pads and we're going to clean the rubber stopper at the top of the vial with the alcohol pad. Okay, we're going to let that air dry. We're going to open up our needle. This is a syringe that's a 25 gauge, 5 to 8 needle with a 1 milliliter syringe. With the cap on, we're going to draw down to 1.0 milliliters of air. Okay. We're going to remove our cap and we're going to inject this into the vial. We're going to inject the air and now we're going to invert and we're going to draw up the medication. We're going to make sure we don't have any air bubbles. Okay, so there is no air bubbles now. We're going to go ahead and withdraw that. And now since we are not ready to inject the medication just yet, we're going to do the one hand scoop cap. Okay, we're going to set that aside. So for a subcutaneous injection, our site is going to be the abdomen. It's going to be 2 inches from the umbilicus. So this is going to be our abdomen here. We're going to inspect the site for any discoloration, any wounds, any bruising, any swelling. And we're also going to palpate the skin to make sure there's no tenderness for the patient. Okay, and then we're also, before we administer the medication, we're going to just pinch the skin And then we're going to put the needle here just to make sure we have about 1.5 of the skin fold and we have the correct size of the needle. So once we have checked that, we are ready to give the injection. We're going to grab another alcohol pad. And we're going to clean the skin about 2 inches outward. Okay. And then we're going to remove the cap from the needle. We're going to pinch the skin, and at a 45 to 90 degree angle, we're going to inject. And because this is a heparin medication, we're going to keep pinching the skin, and we're going to inject the medication for 30 seconds, at a rate of 30 seconds. Okay, we're going to grab one of our gauze. We're going to gently remove the needle. We're going to dispose of that in the sharps container, and we're just going to put the gauze over it, not apply too much pressure. Next thing we're going to do is see how the patient reacts to the medication, answer any of their questions. We're going to go ahead and document in the patient's chart the medication, the dose, the route, and the time. We're going to see if they have any questions, put the collet within reach. We can go ahead and remove our gloves, perform hand hygiene, and now we can go ahead and document in the patient's chart.